parts of yourself in them and that you feel inspired to find access points for breastfeeding to really become a part of that bigger public health conversation in your own community. That said, we wanted to make sure that you continue to stay connected to our speakers today. We've compiled their biographies and included them in a webinar resource guide, as well as on our Continuity of Care website. Links to the resource guide and our website will be shared in the chat, and we'll also make sure to send a follow-up email with all of the links that you're going to be looking for right after this meeting. So now that I've kind of given you a glimpse into the conversations that we'll be having today, we wanted to acknowledge the Centers for Disease Control and Prevention for really funding the development of the blueprint. It's through the Division of Nutrition, Physical Activity, and Obesity, or DNPAO. While their division has funded this project, the views expressed and recommendations outlined in the blueprint and in this webinar don't necessarily reflect that of the CDC, but more reflects a collective thought document from experts in the field. And today's presenters have no competing financial interests or other relationships to disclose. This webinar is recorded, so the link will be shared with all of you and on our website. So please look at the messages in the chat to find the links you might be looking for. And again, we'll be sending a follow-up email with all of that. Speaking of the project design, we can jump right into what this project is comprised of. The blueprint is a part of the Reducing Breastfeeding Disparities Through a Continuity of Care project. So it's a project funded for 5 years. While our team prioritized the development and the implementation of the blueprint, last year in 2022, we funded 10 grantees or communities to implement at least 2 of the recommendations that are outlined in the blueprint. In 2023, our second cohort is 7 grantee communities who are implementing at least 4 of the recommendations. So the maternal, child, and adolescent health team at NACCHO, we support those communities by providing individualized technical assistance to our cohort grantees. We support the development and the implementation of recommendations that they have selected, and we share tools and resources that can strengthen the work that they're doing in their communities. And through this project, we've also provided some technical assistance to some of the CDC REACH recipients. To support our record keeping, we've maintained a detailed resource library on our Continuity of Care website. On our website, you can download the full blueprint. You can download the full blueprint document, learn about past and current grantee implementations, and you can find some useful tools on there to help guide your own work and kind of guide that community brainstorming sessions that you'll probably be having. And of course, we're also hosting this Blueprint webinar series. So each webinar focuses on one of the 7 recommendations outlined in the Blueprint. Today is our 7th webinar, so we encourage you to visit our website and watch those other webinars in the series. For most of them, you can actually still receive those continuing education credits as well. So now for today's focus, that's recommendation 7, which states to assume a community champion role beyond the provision of direct services by really identifying and engaging those key stakeholders. You want to remove those structural barriers to chest breastfeeding within systems, organizations, and the community. The blueprint in itself is a tool for you to use as you approach strengthening the continuity of care and breastfeeding support in your community. And each recommendation can be used as a standalone package. They come with strategies to help implement these recommendations and resources to support your work as well. I'm going to give a high-level overview of the 4 strategies. 7.1 is to build or engage with multi-sectoral lactation support coalitions. Very intentional, and it represents those lactation support touch points throughout the community and including all voices. 7.2 is once you have that diverse multi-sectoral coalition developed and it's centered, explore the gaps within continuity of care. And you want to use a root cause analysis or an equity lens to really understand what people and groups are most impacted. 7.3 is really about recognizing each person's capacity to be an ally, identify and use one's own privilege to advocate and amplify those causes for those who do not hold the same privilege that you might. And 7.4 is really about connecting breastfeeding coalitions to those county-wide health initiatives. And that's usually going to be a county-wide health initiative led by a local health department, led by a community-based organization to better understand your overall community experience. So now that I've kind of given you a glimpse into what the blueprint looks like and how you can leverage it, I'm happy to welcome Camille to the stage. She's going to lead us through a deep dive of recommendation 7 and really spark some more questions for us and reflection opportunities. She's also got some great resources to share with us that might be just fundamental to your community's revolution. And NACCHO is so grateful for this partnership that we share with USBC and for their leadership on the development of the blueprint constellation. They've really brought together today's speakers and connected all of our stories. And so we're just really grateful to be connected to USBC through this work. Camille, I will hand the microphone off to you.
Thank you so much, Soleil, for your warm welcome and for taking us through the continuity of care blueprint process. Hi, everyone. Thank you for taking the time out of your day to join us. My name is Camille Abbe, and I serve as Senior Campaign and Convening Manager at the United States Breastfeeding Committee. I use she, her pronouns. I come to you from my home in Massachusetts, which is near the Assabet River on the ancestral homelands of the Nipmuc and Massachusetts people. So just a little bit about me. My background is in public relations, but I come to the maternal child health field having served as a birth doula and then supporting conferences for midwives and then lactation folks for more than a decade. I'm not someone with birth children or who has ever breastfed, which in our field makes me a little bit unusual. I think it also positions me to be very intentional about listening to the stories and experiences shared from across the field, from folks from a variety of communities, from public health research experts. By listening and always endeavoring to be learning, and by serving in this connector role, I feel I'm making a contribution to reducing disparities and improving public health. And my talk today is offered in service to that intention. As Soleil mentioned, I have nothing to disclose. Next slide, please. For those of you who may not be familiar with the United States Breastfeeding Committee, we are a grassroots to treetops membership organization that uses a collective impact approach with a commitment to diversity, equity, and inclusion. The organization provides capacity building assistance, distributes resources, and offers a connection point for conversations to take place with a wide variety of stakeholders. When those conversations focus on a topic, they may converge into what we call constellations, which are topic-specific work groups focused on the levers that can affect policy and system change. Next slide, please. Those conversations are intentionally designed spaces where folks travel together on a learning journey and collaboratively identify their projects to support change. I'd point out that the topic of our efforts at the USBC is breastfeeding and human milk feeding, but our vision is thriving families and communities with belonging and liberation at the center. We endeavor to offer access to learning and conversations across communities, and as I mentioned before, from grassroots or from organizations representing the grassroots through the treetops. So let's talk a little bit about Rec 7. You can go to the next slide, please. So as Soleil outlined, in the stance of the recommendation, really what we're talking about here is the provision of ongoing high quality and coordinated lactation care alone is just not enough to establish continuity of care and breastfeeding support within a community. Direct service can't address all of the causes of suboptimal rates of breastfeeding. So lactation support professionals and other individuals interacting with families can go beyond the provision of care for families and initiate or join community efforts to advocate for improvement in the broader conditions that affect chest and breastfeeding. Tribal, cultural, local community, or state multi-sectoral breastfeeding coalitions have a wide net of representation and capacity to collectively identify and work on levers for change that can have significant impact within a community. So the strategies can be simplified into 4 categories, and you heard a little bit about them from Soleil, but I'm going to talk about them from a slightly different angle. So the first one I'm going to name is connection. This means a lot of things, from connection with community members to connection with local, state, cultural, tribal breastfeeding coalitions, or with local health departments and community-based organizations to leverage infrastructure resources. Diversity, equity, and inclusion, justice and belonging goes there too, is really about active learning from other LSP and local health staff from the non-dominant culture to actively listen to them as cultural and community experts and achieve collaborative action to build continuity of care for lactating families. Allyship and the recognition of one's own power to advocate for local services and other LSP lactation support professionals who don't hold the same privilege, using that allyship lever, and dissemination and sharing, dissemination of local best practices in the regional, state, and national spaces. Next slide, please. So before we say any more, we'd love to open up a poll. So the question is, Do you currently, or have you ever, served as a connector, a coalition builder, an ally, or an advocate? I'm going to choose all that apply. Is that poll showing up for everyone? There it is. So go ahead and choose one, all. You may not feel like you fully understand all the choices. Yep, just go for it. Should we give it another 15 seconds or so? Excellent. Thank you so much for participating in the poll, everyone. Advocacy coming in strong, 77%. That is not surprising. Allyship, 58%. Coalition building, 47%. When we see where everyone is coming from, that makes a ton of sense. And being a connector at 65% of you. Thank you all so much for participating in that poll. And as I suspected, we're in presence with a lot of people committed to serving others. I'm really grateful to be together with all of you today. So next slide, please. I'd like to share, to take a few minutes and share a story of, it's an example. I won't say it's from outside the field because it's really not. The focus is also nutrition security, but it's a story that I think exemplifies this activity of starting in direct services and via community engagement, shifting the focus to policy and system changes that can make an impact on a broader scale, in this case, global. So this story is about Chef Jose Andres and the World Central Kitchen. I need to say that what I have learned is from research, not direct experience with World Central Kitchen. And I have no affiliation with World Central Kitchen or Chef Andres, but this is from what I understand. So in 2010, after the huge, devastating earthquake hit Haiti, Chef Andres wanted to help. He wanted to help feed people right then and there, and he had the means and the position and the ability to show up and help people. He said right off the bat, this is a quote, "Cooking alongside displaced Haitians in a camp, I found myself getting schooled on how to cook black beans the way they wanted, mashed and sieved into a creamy sauce." That's the quote. And I so love it that it speaks to his humility. He showed up to help and he listened and he learned. Next slide, please. It didn't take too long for this organization to know that food relief was not going to be enough. So they started investing in a food producer network to help create resilience ahead of the next disaster. They train aspiring chefs in skills and safety to build their careers and the food economy. They advocate for more hunger relief and better nutrition. They're working on a clean cook stove technology to help families in acknowledgement of the climate crisis, and they launched a climate disaster fund, which is, again, a commitment over the next decade to help communities impacted by the crisis. Next slide, please. So Chef Andres is also part of the White House Conference on Hunger, Nutrition, and Health. So some of you may have interacted with him or heard him speak during those sessions. And I wanted to share that story because I really feel that Chef Andres represents Recommendation 7 in such a great way, as do so many of you here today. He set out to serve meals one-on-one, handing food to people, and then he notices the systems of oppression and opportunity that could address these issues at a policy level. Next slide, please. So being open and listening broadens the conversation. For the USBC, the focus on promoting, protecting, and supporting breastfeeding and access to human milk has had an evolution in light of the pandemic and infant formula shortage and recall to a broader focus on infant nutrition security. You can read the 4 Pillars blog that former Deputy Director Amelia Smythe-Seeger published on the USBC blog site last June. More information and a 5th pillar iteration will be released in the coming months. Next slide, please. So here we are in recommendation 7.1, intentionally building or engaging with an existing multi-sectoral coalition that represents lactation support touch points throughout the community. Starting from where we are, build a coalition. Coalition could have 3 people, including all voices and perspectives within that coalition. So looking beyond perhaps those 3 people a little bit wider to really center. And I center folks impacted by these disparities and by falling into the gaps. Identifying and leveraging opportunities for the advancements of an equitable continuity of care in breastfeeding support system. So working together to identify those opportunities. Next slide, please. Once you've looked around a little bit, you've broadened the table, there's an opportunity here for distributing leadership across the coalition to maximize the strengths of each partner for maximum effect, right? Not coming in with the assumption that there's one way and this is the way. You'll notice even in the recommendations themselves, these are offered as a blueprint, a model, some suggestions, always with the idea, with the respect that each coalition and each community is going to take what serves them and make it work within their community spaces. Then we encourage the adoption of, you can go back on the slide, we're not quite there yet. Then we encourage the adoption of diversity, equity, and inclusion statements and establish some practices with concrete goals for creating both safe and brave spaces within the coalition itself, embracing the values of mutual respect for the many voices represented, right? Making people know that this is their space. They're not coming in as a guest. They're coming in as a valued expert, as part of the experience, part of the coalition. Recognizing that and welcoming that the exploratory conversations, the identified levers for change, the initial ones, and all of the and likely the priority strategy solutions will change fundamentally when and as new voices come to the table. That is part of the process, and it's to be embraced. Next slide, please. Now it's the time. So I want to mention a resource that I appreciate. It's an insight piece by NACCHO Executive Project Director Ken Harris for what he calls true authentic community engagement. So this is where we're starting from, right? He is naming that authentic show up help, and this is all in the resources you're offered, so you'll have access to it. Authentic show up helps build trusting relationships. He goes on to talk about the importance of place, people, and practices. So when he's talking about place, he's talking about making a welcoming space for community engagement to happen, where people feel comfortable and valued, right? Making foods people like, having welcoming decorations, snacks, a meal, hosting the event itself in a space that can accommodate children. Those considerations help lay the groundwork for authentic engagement. Prioritizing people means ensuring that the right people are coming together. And right, I'm going like this with some air quotes, because really making sure right is what's making sure it's a broad access. So that relies on thoughtfully discussing how to connect with community partners, considering individual circumstances, and making accommodations or flexing as needed. And practices is the third P that he lifts. It's really about the rules of engagement, the agreed upon policies and practices that create the safe space. That could mean developing agreed upon community agreements that are read aloud at the start of each meeting. That's a practice that we utilize in the lactation support providers constellation at the USPC. At the start of every meeting, we ground ourselves on those agreed upon, on those community agreements. He also writes about giving up power, which I just mentioned, bringing together state and community partners and having trust in the process. It can be really uncomfortable when we like something to happen now. It feels urgent, it feels important, it is important, but we have to remember that to go fast, we can go alone, but to go far, we go together. Next slide, please. So to dive a little bit more into the creation of an intentionally inclusive space, Dr. Kimmery Bug once said, "Who is at the table changes the conversation." And I might be so bold as to add on to that, it even changes the meal. Just like you heard Chef Andreas say, and just like we're experiencing, we can come to a space with a great idea. The more people come to the space or come to the party, the better it becomes, the more rich, and the projects will change, the menu will change, the conversation will change. Next slide, please. So that slide is as beautiful as it is. It comes from a presentation that was made earlier this year by former Deputy Director Amelia Smythe-Seeger and Senior Policy and Communication Manager Cheryl Lebetovich. It's called Collaboratively Pursuing Policy Solutions, Lessons Learned from the USBC. It's really a deep dive into that process, right? How to create that framework, how to create trust, and it's offered in the resources list and is linked on the USBC website under Learning Opportunities. So you can access that webinar at your convenience. Next slide, please. So here we talked a little bit, and you heard Tillay mention exploring the gaps within the continuity of care using a root cause analysis. So that's equity lens. It really helps us understand what people and which groups are the most impacted by a situation. It doesn't have to just be about lactation, right? It also helps unearth which institutions or policies or laws are perpetuating those gaps or presenting barriers to ending community breastfeeding disparities, right? It helps us identify high-level levers for change that require the collaborative action to build the continuity of care for lactating families, and together helps the group choose the priority strategies to tackle as a coalition. So maybe your analysis reveals a communication gap, where parents are served by certain institutions, facilities, or practitioners in your community are not getting clear and consistent messaging about breastfeeding and human milk, Your coalition might look at identifying resources, handouts, pamphlets that could be distributed in doctor offices, or maybe hosting baby shower events with information, gifts, and supplies for new parents to connect them with lactation support providers and services in the community, establishing that connection before baby is born. Next slide, please. So as you might expect, USBC offers a root cause analysis tool. It's linked in the resources. This tool provides an easy to follow template. It's very simple. It can be used for coalitions or constellations to collaboratively explore those root causes of the issue they're working to address. The tool can be used to help identify and assess the upstream factors that are contributing to the issue and perpetuating disparities in access and outcomes. And a link to it, as I mentioned, is offered in the resources guide. Next slide, please. You'll see this other resource linked in the root cause tool, but I felt it bears mentioning even though it's from 2015. So it's not from yesterday, it's a little bit older. It's described in the Center for Social Inclusion, which is now with Race Forward. Report is called Removing Barriers to Breastfeeding, a Structural Race Analysis of First Food. Structural racial inequity is a cumulative result of how multiple institutions and policies interact. To understand the root causes of racial inequity and thereby produce solutions that work for everyone, we need to look at the first food system through the lens of the policies, institutions, and people. So this report really highlights the structural barriers that face folks during pregnancy, at the hospital, in their first weeks and months at home after baby's born, including access to baby-friendly hospitals and lactation support. If you haven't already read it or have it in your resource library, I highly recommend checking it out. Next slide, please. So that takes us to 7.3. This is the advocacy piece, advocating for local services using your own privilege. So we really recognize each person's capacity for allyship, being an ally. You really identify and use your privilege to advocate for local services and amplify the voices of other folks in the field who don't hold the same privilege. Disseminating and promoting best and promising practices, tools, resources, financial sustainability, and lessons learned from the successful implementations at regional, state, and national spaces, and sharing resources with other coalitions within the state and across the nation, and with those in the community providing direct services to families. You're going to hear more about this from Monica and Jenny in their talks today, how their experiences inform their activism and community engagement, and how that impact is amplified via connecting with other organizations beyond their own. So I really am excited to hear both of their talks today. Next slide, please. That's Monica and Jenny. And that was me not saying next slide before. Next slide, please. The Kansas Breastfeeding Coalition also offers great resources on their website, featuring tools for building and sustaining coalitions, projects, suggestions for community engagement. I highly recommend it. This is what we're doing. We notice what happens in other coalition spaces, we amplify the resources so that we are sharing. We offer them to the field and to each other. Next slide, please. So this slide is really about connecting breastfeeding coalitions to countrywide and also countywide health initiatives. I would say countywide and then countrywide. This is usually led by local health departments and community-based organizations to better understand overall community experience, identify those leveraging opportunities, disseminate the lactation support resources, and engage with other health and non-health specialties such as community organizers, social services, emergency preparedness, and housing and transportation, community designers, etc., to expand the conversation, right? Taking it from the individual to the coalition, to the community, to the state, to the national, federal, and then ultimately global levels. This might really look like participating in community events like fairs or farmers markets to distribute information and resources. This might look like you inviting county health officials to your conference or your events. Activities that are designed to expand awareness beyond the folks providing direct services to pregnant and birthing people. This can happen, like I said, on the county level, and it can happen on the country level. Next slide, please. Speaking of which, I'm pretty sure most of you are aware that the PUMP Act was recently passed. Take a moment and celebrate. We got to let that land in our bodies. It was. more than a decade-long process to fill the gap that was created by the break time law. It was not a gap that's fully filled yet, but 9 million more workers are benefiting, so it was a huge policy win. I'm bringing this up here to demonstrate the power of that collective effort and talk a little bit about how it can happen on the countrywide, the federal level. So the USBC affiliated workplace support constellation had a project coalition called the Pump Act Coalition, who were really laser focused on this legislation. It was USBC member organizations and partners from beyond the first food field, including faith-based organizations and unions, congressional staffers, and of course, everyone who wrote to their reps, made calls, and then did it again and again and again. So this is a collective thank you to all of you who participated in achieving this win. Next slide, please. So I'm really just about finished, and I want to leave you with the one concept. And here's an invitation, and here's the metaphor. I invite you to take your cape with all of your energy, all of your passion. Next slide, please. And take that cape and turn it into a tablecloth. That is how we get the tastiest, most nourishing meals with the foods that everyone wants to eat, and incidentally have a more connected, festive experience than going it alone. Next slide, please. Among the USBC resources you're going to find in the resource guide that you'll receive is the Breastfeeding Coalition directory. So that's going to help you get connected with a coalition that is already there, that we are aware of. We only can share the ones we're aware of. So if you know one and we don't have it, we invite you to help us get connected. There's information here about joining USBC membership, which offers access to the First Food Connection Hub, which is a space for these conversations to happen. And it's a growing space. We launched it only this year, so everybody has an opportunity to participate as part of those member organizations. The Equity Champion Directory is a space where you can look for a trainer for your organization. We are all on this journey together. No one is presenting or pretending that we are arrived. We are learning together, and we're taking those steps together. And of course, I need to name that this June is the National Breastfeeding Conference and Convening in Bethesda, where we're going to be having some of these conversations in person, including a continuity of care session on Thursday, June 8th. We also are offering a great free pre-conference workshop for conference attendees that we are just about to announce. So check your email if you are in our listservs, called Critical Skill Building Workshop, Leveraging Evaluation for Your Next Grant. And that is facilitated by Kimberly Brutenfield-Massey of Urban Metrics and Calandra Tibbs of Trifecta Consulting. So if you need information about any of those things, I think I failed to put in a slide with my email. I'll pop it in the chat, but it's first initial, last name. Even easier, conference@usbreastfeeding.org. You can reach me personally. And for the last slide, please, I really would love to hear from all of you. So we're going to open up the chat box. And I would like you to, I invite you to share in the chat box in 2 to 3 words who you or who your organization or your coalition has been connecting with that is intentionally expanding your table, or who you're reaching out with to try to get an invitation to join someone else's table. We're going to leave that chat open for just about a minute, and I'm going to just keep an eye on the examples. I'm very excited to hear what all of you have been doing. Who have you been connecting with? Who are you now maybe thinking about connecting with? You don't have to have already done it. As I hand the mic over to our next presenter, who is Monica Esparza, the Executive Director of the New Mexico Breastfeeding Task Force. Thank you so much for your passion, your commitment, and for being here together with us today.
Hi, everyone. Thank you so much for having me here. I am super excited to be in this space with everyone here. And as you continue to share who you're connecting with, I'm going to go ahead and start talking about the role of the breastfeeding champion and a little bit about the New Mexico Breastfeeding Task Force. Our mission is to create environments in which lactation is the norm and human milk is available to all infants and children. Next slide, please. So during this session, I'm going to talk about exploring the gaps, being an ally, and connecting with Breastfeeding Coalition through a story. Next slide, please. Once upon a time, there was a young woman, a little girl, actually. She lived in Mexico, next. And she moved to the US with her family, next. She worked with her family and she supported her family by sometimes translating documents, sometimes being an interpreter, because her mom and her dad spoke only Spanish. Next. This little girl grew up and got married, and next moved to the big city. Soon after she had moved into the big city, she found out she was pregnant. Next slide. So in this big city, this little girl, she found out she was pregnant. She looked for her resources. She had her baby, and then she was lonely. She didn't have her village around. She didn't have anyone around, and she didn't know who to turn to. So she turned to her WIC program, where she attended the support group regularly, because that was the place where she could reach out and where she could feel connected and at least see some adult human people there. And during this visits at the support group, she was invited to become a peer counselor. And as she became a peer counselor, she learned that families needed lots of resources, not just lactation support, but they needed to be connected. A lot of the families that she served were Spanish-speaking families only. And she knew that she needed to find those resources that were in Spanish. So she developed her own resource list of, here, go to this person. She speaks Spanish. Here, when you call this clinic, asked to speak with this other person, they speak Spanish. She also started supporting the families that had to go back to work. And there was this navigation where she had to do, where she had to scale up the conversation to someone else when it was around advocacy support. So she decided that she needed to get to the root of this people that were providing the advocacy support. Next slide. And she found out that it was her local coalition. They were the ones that were providing the advocacy support. And so she knew that she needed to connect into this space so that she could better provide impact for her family, for her families that she was serving, so she could better bring that coalition more awareness about what was happening in the communities, in the workplaces where the families that she served were working at. You can imagine this brown little girl with a toddler in tow, coming into the first coalition and being faced by a lot of middle-aged white women. There were some brown communities in there, but mainly it was middle-aged white women talking about all the issues around lactation and lactation barriers. This little girl felt nervous, so nervous that she wanted to walk back out, but she decided to stay. And whenever they started doing the introductions, it was interesting for her to hear that they were doctors and nurses and IBCLCs, which she didn't really know what that meant. And then when it came to her turn, it was just a mom, a breastfeeding mom, and supports her community through breastfeeding counseling. Next slide. She stayed because she understood that different people bring different perspectives, that in order to bring change, she could do it through a collective work, that this agency had the power to bring knowledge, to bring awareness to the hospitals and clinics and the systems where her community was being served, where her community were being provided care, and so that she could bring all the voices of the many different families that she served to talk about how those different policies and practices needed to be adapted, that BIPOC communities needed the right support in the right ways. She was able to bring her immigrant perspective, her English as a second perspective, as a second language perspective. She was being able to bring the way that BIPOC communities navigate the healthcare systems, how sometimes the systems are not built for BIPOC communities. And so she brought all that to the table, and she stayed. She stayed through being uncomfortable, through sometimes being the only one, through sometimes being questioned about the concept she was asking or the question that she was proposing. Next slide, please. And so with it, while she stayed in these spaces, she started working with this coalition. She started working in workplace support because she knew that it wasn't just enough to pass a law in this state where she lived. There was already a pretty comprehensive law around workplace support, but she knew that sometimes the families that she supported didn't feel strong enough to asked for workplace accommodations when they were concerned about the security of their jobs, when they're concerned about if they lose their job, if they get fired, where are they going to go? How are they going to put food on their table? So she started working in the workplace support to kind of bring that perspective and see how each individual needed to be supported in a different way. She became a program manager as she continued to work within the coalition and the community. It was blending both things together, listening to the different communities that she worked with in the different barriers and issues that were happening. And soon she became a deputy director. At that time, she had her second child, and she herself had already experienced that. She knew all the best practices. She knew all about informed decision. She knew all about what she wanted as far as her birth and her care. And yet, because of the systems, she wasn't able to choose her provider. She had a really hard time trying to figure out and navigate the system so that she could get the care that she needed. So she knew she wasn't alone. She knew it wasn't just her issue. It was the many issues of people of color. But she didn't feel strong enough to become an executive director. She felt like she needed to build her skills. So she luckily became a Bella Academy cohort participant, which was helping her to build her skill set to feel more comfortable in walking into spaces, to feel more comfortable in being a leader, a BIPOC leader in a lot of white spaces, and what that meant and how she could navigate both her lived experience, the lived experience of the many families she has served in the systems, in these ways that could ultimately change what the services that families received. And this story, next slide. This story is my story. This story is how I came from being a peer counselor to engaging, seeing the gaps that my community needed, engaging in the coalition building, and knowing that within the coalition building, there needed to be change. So this is my first poll. And as you heard my story, I want to ask you this question. What does BIPOC leadership look like in your agency or coalition? Is it more than 50%, approximately 50%, or less than 50%? Or you don't know? Everybody just take a moment. All right, let's go ahead and share the results. All right, and not surprising, it's less than 50%. Thank you so much. The next, and so now I'm going to open the chat box and ask you guys a question. Within this community, within the space that you're navigating, what are some ways that you can build BIPOC leadership in your agency or coalition? You heard my story, and you probably have heard the stories of other people. What are some ways that you can build it as an ally? And as a BIPOC leader, if you self-identify as BIPOC, what are some ways that you want agencies or coalitions to engage with you? Yes, encourage diversity within your agency. Working with organizations that are already working with are BIPOC led, right? Make sure that everyone feels welcome, support and training. Yes, growth opportunities, perfect. All right, next slide. Thank you, everyone. You guys can continue to chat in the chat box. All right, so now I'm going to talk a little bit about as I came into the leadership of the New Mexico Breastfeeding Task Force, how we've expanded the work we've done. We developed the term lactation ecosystem, and this term wasn't developed by me. It was actually developed by my predecessor, but it was, I was telling her, all the different systems intersect. We need a way that everybody stops working in silos and is rather working together. And so then she's like an ecosystem. Yes, like the lactation ecosystem. Next slide, please. Within New Mexico, we understand that it's very rural and urban, that the healthcare systems are interconnected. And so we needed to connect with everyone. that there is more beyond the hospital stay. In New Mexico, 86% of families are initiating breastfeeding, and that's great. But what happens after they leave the hospital? What happens when they have to deliver in one hospital in one city and have to go to another city to receive care because that's where they live? So we needed to make sure that we engage our community because they were the ones, boots on the ground, listening to the stories or even experiencing those stories just like I had. And we strengthen our chapters in the coalition. We have 14 chapters across the state that are working with the families that live in those communities, because each community is different, that are helping us to guide the systems and the programs we work within. Next slide, please. As we work within the hospitals, and now we have a pilot program called the Breastfeeding Friendly Clinic Initiative, which engages clinics. We knew that these hospitals and the systems needed someone to refer to when they're needing additional care in lactation. So we built the lactation professional pipeline. And this system, we knew that in order for families to feel comfortable receiving care, most families want the care from people that look like them, that speak their language, that come from their culture. And so we take that into account into every piece of this pipeline mentorship program. We constantly review it, revise it, and adapt, because we know that every time we do something different, we hear the participants and we listen to their feedback, and we listen to their pointers, and we know that we need to change. So we don't just stay within the same program, the same system. We want to help community build and grow their own lactation care professionals within their communities, that are invested in their communities, that know the culture, that know the language. But also we know that because of that, most of these lactation care professionals are self-identify as Black, Indigenous, or a person of color. And so they come with different barriers that they're already experiencing. How can we support that? Next slide, please. So we listen to the community, we collectively collaborate, we engage, we take our blinders off as far as just lactation coalitions, just lactation invested systems or organizations. We know that we have to work with our alternative housing community, because they're going to interact with pregnant and lactating families at some point or another. We know that we have to work with our cities and states, municipalities, because not only do they have policies in place, they also have employees that may be pregnant or lactating families, and they also serve pregnant and lactating families in one way or another, right? They visit the city, they visit the state parks, they visit all these places. So how do we engage all of them? We listen to them as they're telling us that during the New Mexico faced many fires, and families were going to shelters, families were going to places, and as you're running for your life, sometimes you forget things, right? So we listened to them as far as what we needed to put together in alternative housing project bags. We took what we had learned from other entities across the state and nation that have done this work. We adapted it to New Mexico, because New Mexico is a little different, and we put it together. We, as a first-time English speaker, and Spanish being my first language, English being my second language, I knew the intricacies of having to learn different language, different resources in English only. And so we're working with our community to develop our language and equity project, which means that some of our resources are in Spanish, working on accessing into different languages and making sure that they are equitably translated. That means that we involve the community when providing feedback to ensure that they are understood by the people that are going to be served by them. And we also listen to, not all families feel represented or feel seen within our messaging, within our words, within our images. So we adapt and we engage the communities to make sure that they do feel seen, that they do feel represented, and they do feel that the language that we use is the language that they reflect and identify with. So we continue to reimagine, we continue to review, we continue to work with the BIPOC communities, so that we continue to make that change. We continue to center the voices through our, as I mentioned, through our chapters, but also just by our regular engagement of it within our healthcare outreaches or our billboards, everything with a voice in mind that that we need to serve the community, and that sometimes that means that the task force is not the one on the center of the work or leading the work. Rather, sometimes we lead and sometimes we follow. And sometimes we just sit back and wait to be asked to be invited. And with all these pieces, we continue to learn and we continue to adapt. Next slide, please. And I am available to share. You don't need to reinvent the wheel. We didn't. We reached out to some of our partners as we adapted to fit our New Mexico needs. So if you found something here that you want to learn, feel free to reach out to me, and happy to have those conversations with you. With that said, I'm going to pass it over to my amazing partner, Jenny.
Hi, I'm Jenny. Thank you so much for coming to this presentation today, and for this amazing team. I really appreciate all of y'all, and I'm so excited to share some examples of my journey. Next slide. So some of the things that we found are so important are to engage and advocate for our breastfeeding through our community. I'm excited to share about how we did advocate for chest and breastfeeding in our community, and how we included champions and help them along their role. People often wonder, how can I make a change, and what difference can one person make? So I'd like to challenge that thought as I share my journey, and I hope you will find some space in your journey as well. And I invite you to take notes of some things that come to mind while I speak, what you could do in your community, and I hope to spark some of your ideas. And so I'd like to share a poster which I created with some dear friends and mentors and colleagues. And this poster we presented at a ILCA conference, and it just shows the journey beginning at 2004. The journey began before, but we started there when we started the Shelby County Breastfeeding Coalition. And it's so important to build those partnerships. And I'll go into that a little bit later on some of the great things we do. This is available for you in the resource guide, but I just wanted to go over some of the lessons learned and some of the things that we found were really important in your design, and how you can start with that. And we really want to identify and establish your support networks, advocate for efforts around moms returning to work. You can do support networks for our partners. And one thing that I advocate is for the impact of disasters on breastfeeding and helping moms to breastfeed throughout a disaster. We want to educate professionals. We want to take action on issues, and we want to empower our communities. And it's going to be really important to ensure that the lived experiences are at the table and can take action, because a lot of times as providers and as public health professionals, we may have a seat at the table, but a lot of policies and procedures are made based on our thoughts and our experience. So it's very important to include the community. Remember that change takes time. And but at first you want to do something. That's what you want to do. Start those conversations, and you want to really begin to address structural racism issues. Be active in the community, build relationships with your community stakeholders. You want to go to each other's meetings and really build those relationships and support each other. And that way we're going to be able to coordinate and use our talents and our resources. Next slide, please. And so what created a need for a champion for my world? This is me and my son, Matthew. And one of the things I really needed a champion for my needs as a mom. This is my second baby. The first baby, breastfeeding went really well. The second baby had, a little struggle with that. And one of the things is I was trying to breastfeed a newborn based on my knowledge of breastfeeding the toddler and from my previous pregnancy. So I needed help maintaining my milk supply when I returned to work. I was a pediatric critical care nurse. So as you can imagine, taking breaks were a little bit difficult to do at times. So this one, Matthew, he's such a breastfeeding champion. He only wanted breast milk. And it really helped my family to become an advocate for breastfeeding. And one of the things as a pediatric critical care nurse, I saw that there was a huge knowledge gap regarding breastfeeding. And there was a vast difference between breastfeeding the healthy baby, which a lot of resources are on, and breastfeeding your sick baby, whether that be a neonate or an older baby or a toddler. And I found that my peers just really did not have that knowledge. And I didn't have that knowledge either, because they would say, hey, can you take care of this kid? They're breastfeeding, you're breastfeeding. And I was like, I need more answers. I need to know how to help these moms. And so I found that moms really fell off of breastfeeding. And moms had such a grieving process every time they experienced challenges with that. And so I started going to conferences. Interestingly, I frequently was asked at the conference, why are you pediatrics and doing breastfeeding? And I, just am such an advocate for pediatric providers and those that work with the infants and toddlers to become breastfeeding advocates, because we want them to breastfeed through the first year and beyond. And so I decided to go in the conference and with confidence and courage about the need to add peds, and know that everybody can be a champion. It takes enormous courage to go after your goals. You may have some failures, you may have some stumble blocks all the way, but think about those as successes, because you'll know what not to do when you go to the first thing. So next slide, please. So I'd really talk about mentoring. It's going to be really important to establish relationships with mentors, and because they're going to be able to help you when you're walking along the way, when you're crossing the bridge and you're looking at that map. It really helps to have a friend to be able to travel those trails and to make new trails with you. And so one of the things, how did I step into the role as a mentor? My mentor stepped me from struggles with breastfeeding one little step at a time. She was like, hey, let's go to this conference. Hey, why don't you join MALCA, which actually LEAP at that time, which is the lactation professional organization. Every time I would share a need, she would say, hey, let's do this. And 22 years later, she's still my mentor. She's amazing. And they're critical to opening those access points to be able to connect you with the places and the people that you're able to mentor and be able to move that needle. And so next slide, please. And so when we think about these access points, you're going, what in the world? Where are these access points? Well, these lie in your passion. And Camille talked about the cape and, turning that cape into a tablecloth, and know that it looks different on everyone. And so we're going to have different patterns, and that is going to make a beautiful kaleidoscope of the ways we can help breastfeeding and move that forward. And often we can get, we have our trail, and we have to be careful not to get lost in the wilderness and lost in the woods, because we want to look at what our own passion is and travel that trail. There's going to be other people that have other passions, and that's where you mentor them along, and then you create this amazing network. Next slide, please. So let me ask you a question. When you're thinking about access points and you're thinking about where do I land in this? And a lot of times when we think about that, we're like, oh my goodness, we don't have these, we don't have money, we don't have this. Well, what if money and resources were not an issue? What would you advocate for? If y'all could just put some things in the chat, and you can put some things in the chat as long the time that I go. I would love to hear from you. Like, what are some things, what are your big ideas that you would love. I've asked this question in some of our board meetings before, and some of our member meetings, and they said, I would love to do this, but this and this can't, happen because of funds. And then another professional or another person comes up and says, hey, you know what? Actually, I can help with that. I've been looking for somebody. And then you can really connect to people. Absolutely. Paid maternity leave. Access to doulas, on-site lactation care. Absolutely. Those are going to be things that are really going to hit home and help with breastfeeding. Maybe there's somebody that has tried to start a daycare, and that would be a great support system. Yes, lactation support in every hospital. Absolutely. Absolutely. Yes, home visit for everyone. That home visiting support is so important. And so we need to develop that network. And we may have providers, or we may have, lactation consultants or lactation counselors, or even peers that want to develop a network. And I'll show you some of the ways that we did that. And what's going to be important, you can think, oh, I want to do all these things. You want to make sure you get the right seat at the table. And how can we get those key players? And a lot of times those seats are empty, and you can fill those seats. And a lot of times we'll wait and we want to be asked, but it's going to be important to just jump in and say, hey, yes, I love that. Yes. Thank you, Tracy. Yes, I want to jump in and really be able to coordinate. And that is such an amazing thing, to be able to coordinate, and also to just be able to mentor others. And I love, I say often that I sometimes spend Friday nights over wine and saving the world through breastfeeding. And those mentors have really become amazing friends to me. One of the things you really want to do in your community is engage through coalitions. That helps so much. It began as lactation education and promotion for Memphis. Back when I first started, that's what the organization was. And then we found a need to develop the community response, right? To develop what we need in the community. And we also had a need to continue to engage professionals and, our lactation consultants, our lactation counselors in education, so they can have that lifetime learning. And so we split these until the Shelby County Breastfeeding Coalition and MALCA, the Memphis Area Lactation Consultant Association, as sister organizations with great partnerships. A lot of us are in both organizations, of course, and but it really does help to separate and to have that mission of educating those that are, your lactation consultants and counselors and nurses and physicians and all of those, and have the one for the community where you can do community engagement. So the out of that, we a group developed B-Stars. It's Breastfeeding Sisters that are receiving support. It is a organization for women of color, made by women of color. And that's just a way that we decided to become an ally for the women of color. And what is great is we said, goodness, what are we going to do? And then we had some amazing women that said, we need an organization that really just focuses on women of color. And that has been a great resource to our community. The Tennessee Breastfeeding Coalition actually came out of these. And which is really cool. There's a coalitions all through the state that collaborate into the Tennessee Breastfeeding Coalition. We just met at the TIPQC conference in Nashville. It's our state perinatal quality assurance conference. And so one of the things that we also did that we do every single year, we started in 2017, we called it MABS, the Memphis Area Breastfeeding Symposium. And we pulled together our community leaders. We started with our mayor, and then we started with the assistant commissioner and the director for family health and wellness, the director of the health department. We really pulled in some other great resources to be able, and we also pulled together panelists. One of the coolest things that I think we do is we do this roundtable brainstorming idea where at the end we make tables of different where people can collaborate and say, what do I want to do next? And those ideas have come into amazing actions, such as amazing initiatives that we've done across the state to increase access to lactation support. I do want to plug our Tennessee Breastfeeding Coalition, Tennessee Breastfeeding Symposium. Save the date for June 22nd and 23rd in Knoxville. And I will we'll put this in the resources. And I'm so excited that we're continuing this. And we've taken it from Memphis to Nashville to Chattanooga and back to Nashville. And we're taking it to Knoxville. So it's incredibly exciting. And so next slide, please. So as far as community engagement, another thing that we really needed was we have the breastfeeding sisters that are receiving support, and it's for women of color by women of color. But there was a lot of stigma about women of color that are breastfeeding in public, and about it being the way it looks per se. And so what we did is we did a Black breastfeeding art exhibit at the Orange Mound Art Center, and this was an amazing place to be able to pull together a lot of our networks and our local and national and state networks they really went together and supported the initiative for this. And it's really cool because these women were on display at the Orange Mound Art Center for 2 months. And the display is Black women breastfeeding. And there's some amazing and beautiful pictures. And a lot of them were actually shot at the, had the photo shoot at the Civil Rights Museum. And so it's really cool to have that correlation with that. One thing that we also have as far as engaging the community is our Breastfeeding Coalition resource guide. This talks about the Shelby County Breastfeeding Coalition's mission. It has information about the Tennessee laws about protecting breastfeeding. Show mom that they can have workplace and public support for being able to breastfeed. It has lots of information about all of the different community resources that we have in Shelby County. I love how this list grows and grows. I think we're going to have to make it several pages now because the list has grown so much. And that is a result of all of our efforts and our commitment to mentoring and to lifting each other up and being allies for each other. Another way that one thing that I did, I saw that Breastfeeding Medicine had a special issue of breastfeeding in the Black and African American. And this is an experience we wanted through a cultural, social, theological, and health dimensions, and looking this through an equity lens. And so I thought, oh my goodness, what better than to present and to publish B-Stars. And so I went to some of our amazing stakeholders, and I looked at went to Tiana and Shakira and said, we need to publish this. And so we did. And it's so exciting to talk about something that is so unique and that we have in our community. And it's great. I get so excited every time it's cited and every time we have other communities that use this as a framework. And so my journey continues, right? I want to continue in the community. I'm involved in multiple initiatives, and one of the big things I'm doing right now is I'm a PhD candidate, and I'm doing my research on the impact of disasters on breastfeeding moms. And I want to do it through looking at the lived experiences of the moms. We need to get, in my opinion, I wanted to get all the way back to the qualitative research because I really want to tell those stories of the moms. I want to see how, what makes a difference with those moms. I want to continue mentoring and continue that lifelong learning there. And so the way I'm doing this, if you could go to the next slide, please. And by the way, those were my kids as they've grown up, and it's so cool to see see my children grow up. So for my dissertation study, I'm combining my knowledge of maternal child health, breastfeeding, emergency preparedness, and disaster response. And I'm looking at the Southern United States where I live. I live in Memphis, Tennessee. And because one of the problems is our existing plans to mitigate the health consequences during disasters are very far in between. And so we have existing plans. CDC has a great guide, but the problem is that FEMA, some of the interventions and our frameworks in FEMA do not include lactation support. And so we need to be able to help mom and baby bounce back from the disaster, often without having that support and without having those plans. There ends up being a lot of well-intentioned and short-sighted interventions. And so we need to check the plans. You know, what, when you're thinking about from a design standpoint, what am I going to do, right? So we need to check the plans. This is going to look different for every single jurisdiction. So I'm going to do that qualitative study and I'm going to compare to some disaster plans. So far, I found that there are actually very few disaster plans that support breastfeeding. Like I said, the FEMA common items needed in sheltering, they include formula and bottle feeding supplies in their infant and toddler kits, but does not include anything regarding breastfeeding supplies or support. And then the protocols with the functional access needs, although HHS includes breastfeeding in part of the functional access needs, it does not include that in our FEMA guide. So it's going to be really important that we look at our local plans, right? For us, the Tennessee Emergency Management Association, and our local plans, those are some things that you can do. And see what resources that you have available, right, in your own community, and to be able to help moms and babies. And so, what, you know, something we can do, maybe it's an intervention, we can coordinate and engage lactation providers. We really don't want to self-deploy. We really want to connect with other disaster organizations. It's something that you can do in your community. Then you don't have to start from the ground up. Because they already have those procedures for volunteering in disasters. Some options could be Red Cross, Medical Reserve Corps. There are plenty of options, and I encourage you to get together a team and to go to some organizations and to be able to volunteer your services as breastfeeding. I'm called often as a disaster volunteer that said, hey, we have this breastfeeding mom, what do we do? How can I help them? And often these moms just feel like they have a low milk supply and really just need that. A lot of times moms just need the encouragement because formula is often just handed out like through an unsolicited uncoordinated distribution of formula. And if you think about that happened with our those baby bags, right? Those baby diaper bags that we gave out a long time ago, right? And so now that we're moving towards baby friendly, we found that those actually decrease breastfeeding rates. And so it's going to be very important that we support our breastfeeding moms. So next slide, please. And I want to thank you so much for this incredible opportunity that I had to share my story. I'm excited that, you know, to be able to share my story. Everybody's story is going to be different. And it's so important to do what we are passionate with and present that on into the community. Does anybody have anything more in the chat that I'd like to just peek at the chat, see if there's anything? So no, okay. Well, great, thank you. We will continue that into the Q&A session. So Talia will close us with recommendation 7, and she's going to show how that is. Recommendation 7 is in action and sharing some of the successes of the grantees in their implementations of the recommendation 7.
Thank you so much, Jenny. Thank you, Camille. Thank you, Monica, for your presentations. You all spoke so wonderfully about recommendation 7, about the work that you're doing. I'm very inspired myself and just very excited to keep learning more. There's some other people in the chat who are also very excited to keep learning more. So yeah, I will move into recommendation 7 in action, kind of understanding what some of our blueprint grantee successes are. And I'm going to share 2 examples of 2 of our grantees and our cohorts who are are working on recommendation 7. So the first one is one of the 10 Blueprint grantees from 2022. They are the Minnesota Breastfeeding Coalition. This coalition partnered with several communities in Minnesota to complete their work. For recommendation 7 specifically, they partnered with the Twin Cities Regional Breastfeeding Coalition to develop a community leadership pipeline for people who identify as Black, Brown, Indigenous, and people of color. So there's 3 community leaders from the coalition who were really guided and supported to use the Equity Action Lab to process to gather community perspectives and ideas about leadership, and then kind of promote and support lactation moving forward. Handing over the project to these leaders really ensured that the questions asked of community members and the approach to understanding the notions of leadership were grounded in their culture. The recommendations you see on the slides were presented to the broader coalition, and the coalition is regrouping post-pandemic and using the pipeline recommendations moving forward, steady and intentional. An extraordinary grantee of the Continuity of Care Blueprint is Lactancia Latina of Southwest Kansas, and they work in partnership and mentorship with the Kansas Breastfeeding Coalition. This is a community-based organization, and they're actually in their 3rd cycle of the Blueprint grant with NACCHO. They've implemented all 7 recommendations in the Blueprint. The Breastfeeding Coalition has an incredible role model. The Kansas Breastfeeding Coalition has been an incredible role model in the breastfeeding space. They've been intentional and mindful in their leadership, especially while sharing their infrastructure, expertise, and relationships with Lactancia Latina. They've been serving as a fiduciary for the Blueprint grant, so really a true ally. Specific though to recommendation 7, they've gone above and beyond in the breastfeeding networks and beyond the maternal and child health field within public health. They've really connected with organizations in countywide health, wellness, and social service coalitions, places where breastfeeding was not really a part of the agenda beforehand. And they went in and transformed some of the workflows so that breastfeeding and maternal and child health are integrated into the design of the public health infrastructure and those programs. So this partnership's really fueled some relationships that fostered mutual participation in partner events, such as the ones you're going to see on screen. So there's some health fairs, there's engagement events, family engagement events, the hosting of a care station at a soccer tournament, and they even sponsored a karaoke night. So through these connections, they've really connected with more people in the community. It developed new and lasting relationships with new community partners. And unexpectedly, they earned and secured some additional funding to implement another breastfeeding bench in their area. Speaking of the Kansas Breastfeeding Coalition, we really encourage you to join us at our next webinar. It is the 8th webinar of our 8-part series. We will be talking about recommendation 4 and Kansas Breastfeeding Coalition, along with some other grantees and partners. We'll be there to present and share a lot of their work that they've been doing with the Blueprint, their successes, some of the challenges that they've experienced. And so we're telling the continuity of care story with community breastfeeding data that's happening on June 28th, 1 to 2:30 p.m. And we're going to share the link to register for this webinar in the chat. This will be the last webinar of our 8-part series for every step of the way through the first 1000 days series. And now the information that we know that you've been waiting for, it's our continuing education credits. And so we're also going to be sharing a link in the chat. This is the post test. It's a post test / evaluation for you to earn LSERPs 1.5 of the LSERPs and 1.5 of the CPEUs. So please take that post test. We really encourage you to take that post test and earn and claim your continuing education credits. As for the CDC continuing education credits, we will be sending out an email to everyone who has registered with instructions, and you will receive that early next week. Now we'd love to open up our Q&A session. Again, thank you so much to our panelists. We're just super excited that everyone was able to join and speak to their breastfeeding champion story. So I'm going to open up the floor to everyone. If you want to use the Q&A chat, we will be accepting questions. Yeah. And to start us off, I would love to ask Camille, question. So does USBC, how can coalitions really get involved on the national scale?
Thanks, Talay. Okay. In the spaces that we call constellations, work groups, we have work topics focused on a variety of things. ranging from infant and young child feeding and emergencies to workplace support. There's a project happening right now that is all about implementing and creating communication tools for the Pump Act. So very specific work groups focused on lots of topics. There's a formula marketing or disrupting formula marketing, talking a little bit about that. So there's a lot of different conversations that can be had. And in order to have access to those, they are designed to be for members as a member benefit. I will say for coalitions that the barrier to entry is very, 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 very low. Like, you know, in the tens of dollars to join USBC and be part of this conversation. And so that gets you access to lots of different member benefits, but it also enables you to join in our twice a year membership meeting, as well as be part of these work groups focused on all of the topics and more. And I'll put a link in the chat as soon as I'm done talking about what the constellations are, and also a coalition directory. So if you maybe are part of a coalition and you're not sure if you're part of the membership, or if you've never heard anything about being a member organization, a member with USPC, we really invite you, because we only can talk to who is in our networks, right? And part of what we're talking about here today, and you heard Monica saying and Jennifer saying, is listening and expanding the table. And again, just, you know, putting out that opportunity space to have dialogue for national nonprofit organizations all the way to coalitions of a handful of people. And all of those experiences are valued and needed for that bidirectional learning to happen, and for us to really activate those levers for policy, system, and environmental change. Did that get us there?
I believe so. Thank you so
Okay.
much. Awesome. I'm going to ask a question to Monica that was asked in the chat. They said, can Ms. Monica please go back to the slide about lactation care pipeline and share a little bit more about each of the roles represented in the boxes? So I'm going to pull up that slide.
So as she's pulling up the slide, really what we wanted to do is, as I mentioned, is support the communities to grow their own lactation care providers. One down. Go to the next one. The other way. There you go. So at the New Mexico Breastfeeding Task Force serves as the fiscal agent for the WIC Peer Counselor Program. And so the peer counselors are already in one way or another connected to the coalition as a whole. We've been more intentional about partnering with the WIC program to talk a little bit more about the resources that the task force serves and how they can get involved. We also understand that home visitors play an important role in supporting families. They are serving as in a way of closing the gap. So, but we did a couple of surveys, and every time they came back that only 45% of home visitors had received little or lactation training. Sometimes it was just their own personal lived experience, and they wanted more. So we created a lactation training just for home visitors themselves. We continue to support the clinic staff within the baby friendly and the hospital friendly initiatives that we do, so that each of those agencies have the support assistance in place, so that families receiving care can get that support within the system. And now we're building the professionals, or the lactation professionals. We build a certified breastfeeding specialist cohort. And what that means is that any of these, like the peer counselor or the clinic or hospital staff or the home visitor that is ready to take the next step to increase their lactation training, they apply for this scholarship. So they're able to take this year, it will be the Lactation Education Resources Certified Breastfeeding Specialist training already. We didn't build a training, that's already there. The only thing is we provide the scholarship for it, but we build a cohort. We want them to interconnect with each other. So they're going to be working as a group to go through this training together and to learn from each other. And we have a mentor who is guiding them so that she can answer questions, so she can support them through the process. And at the same time, they each hold each other accountable so that they can complete the training themselves and lift each other up. Then when those people are ready to move forward, and not everybody's going to want to be an IBCLC. Not everybody needs an IBCLC. But for the people that are ready to take the next step to be an IBCLC, we are providing a lactation education scholarship so that they self-identify what they need, and we provide the funding so that they're a little bit of funding so that they can take that next step. And hopefully in the next couple of years, they're able to sit for the IBCLC exam. So we provide scholarships for people to sit for the IBCLC exam. All these scholarships and all these trainings are very intentional, that we center BIPOC communities and marginalized communities. Those are our priorities, people that are working with tribal communities, people working in the rural communities, so that the lactation spaces where there's not a lot of lactation deserts, where there's not a lot of lactation care, that we're able to grow that. So we continue to talk to the community and hear, like, what resources exist in your community, and if there's none, are you interested in being part of this work? Hopefully that answered the question.
Wonderful. Thank you so much, Monica. That was such great information. I'm going to pivot over to Jenny. There's a question in our Q&A for you. For Jenny, can you describe how the Shelby County Breastfeeding Coalition grew and how you were able to include so many different areas? Also, how do you distribute your resource list, and do you recognize different levels of care available in your community? Oh, you're on mute, I think.
Thank you so much for that question. So how the Shelby County Breastfeeding Coalition grew, yeah, it grew from a group of 4, 5, and 6 people to more and more, and that really was really this framework of mentoring. And then also a framework that we had at Le Bonheur with do one, see one, teach one, and that's borrowed from the residency programs. And that really helped so much, because we would bring people in one at a time, and we'd be like, oh, wait, you're excited about this? All right, here's a project, why don't you do this project? How can we support you? And I really think that that was how we were able to grow so much, is because of that how can we support you framework right there. We started, goodness gracious, from breastfeeding updates and the Memphis area breastfeeding symposiums, and we did things like revise policies, for some of our hospital systems, and created this breastfeeding sick infant booklet. The babies that were born to be breastfed campaign really launched us off. We still wear these shirts that are black and have white, and it just says babies that are born to be breastfed and the top 10 reasons to breastfeed on the back. And so it is right there. We use those for our we still use those same shirts for our health fair. So really it's getting out into the community is how you grow, and really just pulling in those that are excited about it and supporting them in that way. Let's see, goodness. So how do we distribute our resource list, and how do we recognize different levels of care available in your community? So we distribute our resource list through our ShelbyCountyBreastfeeding.org has a resource list on it. It also has links to BSTARS. And so how do we distribute it? We do that. We print them out and have them at health fairs. We also have a big email list that we have of stakeholders and community lists of over 1,000 people that we email just about updates and about things in the community, and make sure that they have that resource list. And these are stakeholders from different organizations, so they can take that to the organizations. How do we recognize different levels of care available? Part of that resource list, and part of we have information, and we distribute information to the community about the different levels of care and lactation, and when you would want to see an IBCLC for that professional clinical level of care, and when the CLC or CLE, CLS, one of those 20 different certifications, when those are the more appropriate, when moms are, just now brought home from the hospital, and when those are the more appropriate times for education, and they're really great for that. Our peer counselors, are also an important level of lactation care in our community, and I love that we have peer counselors through WIC, but we have also created this peer support group through BSTARS. And so how do we recognize those? Through our website and through our interactions with the community.
Amazing. Thank you so much, Jenny. And again, thank you, Monica and Camille as well. We're so grateful that we were able to all get together on this webinar and really discuss recommendation 7 and what it means to be a community champion and what that looks like as we move forward and consider pathways for us becoming community champions ourselves, or even encouraging a friend, a neighbor, people on our colleagues as well to become community champions themselves. So again, thank you so much. A special thank you to USBC. Again, we're just always so glad to have a partner in this work. And with that being said, I will let you all go and continue on your day. And please reach out to us if you have any questions. I'm going to include our breastfeeding email in the chat. And again, all of the links are available on the resource guide. We have links to the slides. We will be sharing out a link to the recording. We've got links to the SERPs and CPUs post evaluation. And we're also going to make sure to include the contact information for Camille, Monica, and Jenny. Have you any questions moving forward? And if you do have any questions and you don't know who to contact, again, the breastfeeding email is in the chat and we will make sure to get back to you as soon as possible. Have a wonderful rest of your day and we look forward to seeing you soon.
Thanks so much, Talay. Thanks, everyone.
Thank you.
Thank you.
Have a wonderful day.